Chiropractic is basically the science of finding a misalignment on a patient, whether it be from car accident to I fell yesterday or just sleeping the wrong way. And we correct it, and it takes the irritation off the nerves. We treat all the way from the neck down to the toes. We can treat any joint in the whole body, whether it be you're having knee pain or headaches or even carpal tunnel. We can, if it's a joint, we can treat it. It's a safe, non-invasive way to treat pain and symptoms. My youngest patient has been 8 weeks old, and my oldest patient has been 94 years old. So there's different ways that you adjust different age groups, and it's just dependent upon the patient. What I'm doing is giving the body the ability to perform at 100% of its capability. I'm taking the irritation off the nervous system, and it's kind of like a branch being on a telephone wire. The telephone's not going to work as good as if that branch was removed, and that's what I do with the nervous system. Symptoms are the last thing to show up and the first thing to go away, so people tend to wait until they're in severe pain before they see a chiropractor, but the problem could have been going on for years. So lots of times it's good to go get a tune-up, is what we like to call it, or maintenance care, once a month, once every 6 weeks, just to keep your body in alignment. If you're having active symptoms, usually we see you once or twice a week for the first 4 to 5 weeks. The symptoms go away, and then we just try to maintain it and make sure that your body stays in alignment and holds the adjustment. When a person's low back starts hurting, well, it usually comes from either the vertebrae, the bones in the back, being rotated, or the pelvis being rotated. And that could have started long before the symptoms actually show up. And over time, the body it tries to fight it, and it tries to make it better on its own, and eventually it just wears out. And then that's when the person starts experiencing the pain. While other times you can experience pain immediately. If it's severe enough, if you fall and you rotate your pelvis enough, or you sleep wrong and your neck is so out of alignment, the next morning you'll feel the pain. And that's something that just comes on right then. Typically, if you're having an active problem or pain is present, we usually like to see you once or twice a week for the first few weeks, and then once we alleviate the pain and we know that your spine is holding itself where it should be, we usually see you once a month to once every 6 weeks, just for a maintenance care, or a tune-up as we like to call it. I'm a provider for most of the major medical insurance companies. They do allow it as long as it's medically necessary. So if you're having an active problem or your spine just isn't staying in alignment, they will cover it, and we are in network. On the first visit, they will get a consultation with myself, and I'll kind of dig a little deeper and see what the problem is. I'll do an exam on them and do some orthopedic tests to check and see exactly, okay, is it this area versus this area? If I feel like there's a need to, we do have x-ray here on site. I'll perform an x-ray, and we also develop it here on site. So typically the first visit, unless you're just in intense pain, we do therapy to calm down the muscles, and then we wait for the adjustment till the second visit, so I have a chance to look at your x-rays, find out what's really going on, and then the second visit when you come in, I'll explain the x-rays to you, I'll show them to you, show you what points are being affected, and then we start the full treatment plan. And I'll go over with you what the treatment plan is as far as how many visits I think it's going to take you as an individual to alleviate your specific problem, and then we'll start the treatment plan as far as the adjustment as well as the therapy.